Hey, you. Yeah, you. Welcome to the Malaka podcast. Sore throat. Ladies and gentlemen, I'm aware that I did a podcast before about, it sucks about being sick. Whatever the fuck I called it. I don't know. I forgot. I don't remember what I did yesterday. But, anyways, sore throat is just even more of a pain in the ass because you can't really talk. I mean, I can sort of talk now, but not really. I mean, it sucks. Like you know how you have one of those like old freezers and like you don't like defrost it, and I don't even know if this is a problem nowadays, but yeah, like it just gets smaller and smaller, and yeah, like that's what it feels like. Your throat's just getting smaller, and it's hard to swallow, and oh god, it's like a huge lump in your throat, and it just like it really just sucks, man. I mean, I don't know. I feel dizzy and shit. Anyways, so yeah, I figure, you know what? I wanted to do some podcasts, on the Joker and maybe do another, the worst job I've ever had. Maybe do a whole series of those or do something about wallets and shit. But you know what? Fuck it. I can't talk. But again, I did not want to waste this day off, So I was like, you know what? Let me just come out with a podcast with a sore throat. And maybe we can figure out why mankind has not figured out a quick cure for this shit. So, oh, yeah. All right, let's figure the shit out. According to good old Wikipedia here, the free encyclopedia. Okay. For those of you under the age of 20, one day I'm gonna teach you guys what an encyclopedia is. It was these big ass books that we had to pay for, which serves no purpose. I don't know where the fuck I'm going with this. Let's just get this shit over with. Okay, sore throat. Sore throat. Like Jacob Tutu here. Also known as throat pain. Yeah, thanks, buddy. Is pain or irritation of the throat. It is usually caused by pharyngitis, inflammation of the throat, in brackets. Okay, thank you. Or tonsillitis, inflammation of the tonsils. It can also result from trauma. Okay. Yeah, it's true, I guess. I mean, maybe it's like, if you got in like a fight with somebody or, some shit accidentally went down your throat. Not actual shit, I mean, But then again, who knows nowadays? I don't know. I just saw a thing online where you go to like restaurants and they have that like menu, you pre-order, because you don't feel like standing 10 seconds in line for some reason. And there's literally fecal matter on the screen. So obviously that shit's just going to somehow get in your throat. You're eventually going to cough or cover your mouth or eat with your hands. And, it's not like you go out for food and like before you sit down and eat you go to the bathroom, wash your hands, because that would require you bringing your food with you to the bathroom, and that's just fucking disgusting. So yeah, you're basically screwed. About 7.5% of people have a sore throat in any 3-month period. Fuck, that sounds like me. Yeah, when I was younger, I was told my tonsils had to be removed. I remember watching that Fresh Prince episode. And yeah, it was like, I remember he said it was like swallowing a weed whacker or whatever. And I was like, you know what, fuck this. I'm not doing this. So, but I kind of regret not doing it now, to be honest. I mean, I guess I could still do it, For those of you, that listen to the podcast, all three of you, I did get a circumcision at 28, so yeah, I guess anything is possible. Sore throat is pain anywhere in the throat. Okay, thank you. Holy shit! Look at the picture they got here on Wikipedia. It looks like it's sort of, yeah, we all know what it looks like. Okay. differential diagnosis. Fuck, I can't even talk, man. I don't know. Most of the times, most of the people that listen to this podcast know I can't talk anyway. So, a sore throat is usually from irritation or inflammation. The most common cause, 80%, is acute viral. There's that word again. Pharyngitis. That sounds right. A viral infection of the throat. Oh, God, it hurts to swallow. Anyways, other causes include other infections, brackets, such as streptococcal trauma, and tumors. Oh, fuck. Yeah, that's all I need to hear right now. Gastroesophageal acid. Yeah, sure. Something about acid. Reflux disease can cause stomach acid to back up into the throat and also cause the throat to become sore. In children, streptococcal, it sounds Spanish, pharyngitis is the cause of 37% of sore throats. Okay. All right. Well, obviously, growing up, we didn't wash our hands enough. I mean, that's for sure. Yeah. I mean, this is the problem with this, disease. I mean, this shit can come from anywhere. Oh God, it even hurts to burp. Anyways, yeah, fuck me. Yeah, like it hurts, man. I mean, you touch shit on the bus, or I don't know, someone passes you a book, if you actually read, it can come from anywhere. It doesn't really matter. This is your management. Pain medications such as non-steroidal anti-inflammatory drugs. Oh, take two. In brackets, NSAIDs, small s. And paracetamol and septimol. Guys, it really hurts to talk here. This is not a good time for me to learn words at the age of 37. Help in the management of pain. The use of corticosteroids seem to increase the likelihood of resolution. How sad is that? I can't even pronounce that word. And reduce the level of pain. Guys, I just want you to know, keep in mind, like, when I talk, like, it's one of the, like, see, the worst thing is when I get, like, a throat infection, I know what's going to happen in the morning. And then the next day I wake up, it's really fucked up. But, like even the, what do you call it? The anticipation. Thank you, Carly Simon. And, it just really, it just sucks. So, it sucks having the sore throat, but, it's just going to get worse, man. Let me continue this brilliant podcast. Antibiotics shorten the duration of pain symptoms by an average of about 1 day. I hope so. I'm going to go see a doctor tomorrow. Yeah, that's the problem. When you go too soon for shit like this, they'll be like, oh, something's coming. We can't prescribe anything for you now because we don't know what it is. I'm like, dude, I get this every, whatever, every, I don't know, before the weekend. So, I don't have a good time that week. I know what's going to happen. You know what's going to happen. Just give me the pills now so I can just be on my merry way. But they have to be good doctors, and they can't do that. There is an old wives' tale that having a hot drink can help with common cold and influenza symptoms, including sore throat, but there is only limited evidence to support this idea. If the sore throat is unrelated to a cold, it is caused by, for example, tonsillitis. A cold drink may be helpful. Well, I've been guzzling water like a camel all day, and I don't know, I feel way worse. I should not feel this tired with this much rest. But again, we gotta listen to the doctors because I did not spend 10 years in school. There are also other medication like lozenges which can help people to cope with a sore throat. Now, ladies and gentlemen, I'm not going to lie to you. I've been taking lozenges all my life. They don't do shit. This is something that I think that was invented, way back in the day. I don't know. I like to call them the placebo effect, with sugar. But yeah, I feel they don't do shit. I don't know. That's just me. I mean, if you want a tasty treat, in a lemon or cherry form, that'll somehow open up your nasals and keep you going there, fine. If not, just, I don't know, stick to Skittles. Without active treatment, symptoms usually last 2 to 7 days. Okay. Yeah, it's possible, I guess. I don't know. It always seems like longer for some reason, but man, I had shit to do this weekend, man. This is some bullshit. Anyways, epidemiology. Epidemiology. There you go. In the United States, there are about 2.4 million emergency departments visited with throat-related complaints per year. Well, this is oh God, this is all fascinating stuff. Oh man, it just that like let's say if you had a bunch of workers in your throat and they're just like grinding your throat with sandpaper. I mean, this is what it's like, man. It's not cool. It feels weird. I don't know. I got like a deep voice anyway, and I don't know. Isn't it cool, like, sometimes when, like, a woman gets sick, her voice sounds hotter, but then a guy, I don't know, we sound miserable and shit. I don't know. Again, this is all just things I'm just thinking about right now, because I don't know what else to say about this. I mean, it sucks, man. Like, it really, really sucks, You ever accidentally swallowed, like, a razor blade, and it's going down your throat, like, blade first, not like on the side, but like I think you know what I'm trying to say. But yeah, it's not good. It says here on another website that symptoms of a sore throat can vary depending on the cause. Signs and symptoms might include pain or a scratchy sensation in the throat. So yeah, pain that worsens with swallowing or talking. Yeah. Difficulty swallowing. Yeah, it's like a big lump, man. It sucks. It's like someone just, it's like you got like a tennis ball in the back of your throat, and not one of those like, tennis balls that like, are smooth, the ones that have that little fuzzy feel to it. You know what I mean? Like a new tennis ball. Let's just say that. Sore, swollen glands in your neck or jaw. See, here's the problem. Like, I'm already fat, so it's hard to tell when something is swollen. I mean, I don't feel anything. I mean, you go to the doctor and they kind of like feel your throat, and you're like, oh wow, this is this is swollen, But then in their head, they could be thinking, wow, this guy's fat, or, he's got a shave or something. But I don't know. I guess we'll see in the next couple of days. Swollen, red tonsils. Yeah, that's true. Feels very sore. Feels like, fuck does it feel like? It feels like, it basically feels like someone just lit it on fire, but then, like, quickly put it out. Like the sensation is still there. It's just, it's not good, man. It's not good. White patches or pus on your tonsils. Yeah, it's possible. Very possible. I really wish I listened to my first doctor. Um, yeah, I'll figure something. And a hoarse or muffled voice. Well, my voice is always muffled. I sound muffled now. Um, my face looks like a horse. I could sound like a horse. Hold on. It's close enough. But yeah, it's a very, it's a pain in the ass, you know. And then, of course, he says here it's going to lead to other shit, you know, which I can't wait for. Right before Halloween. Perfect. Infections causing a sore throat might result in other signs of symptoms, including fever, cough, runny nose, sneezing, body aches, headache, nausea, or vomiting. This is starting to sound like one of those like commercials, you know, like, you know, you get shit faced and then like you come home and then it's like 2 or 3 in the morning and, you know, side effects may include blah, 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 early death. Wait, what? Um, oh, this just keeps getting better. Okay, when to see a doctor. Okay, all right. Thank you, Internet. Take your child to a doctor if your child's sore throat doesn't go away with the first drink in the morning. Okay. Oh, okay. I wish I read this about 12 hours ago, but okay. Recommends the American Academy of Pediatricians. Okay. I assume that goes for Canadians too. Uh, get immediate care if your child has severe signs and symptoms such as difficulty breathing, difficulty swallowing, unusual drooling, which might indicate an ability to swallow. Yeah. Ladies and gentlemen, I'm far from a child. I have been for many years, but at the same time, I still have the mentality of a 12-year-old. So I'm pretty sure this is, yeah, I feel dizzy as we speak. This is my lot, my lows, my loss, my lows, my last podcast. I'd like to thank all you guys, all three of you, for the support over the years. You know, I'm just putting that out there. You know, I should be fine. You know, but just in case, I mean, you never know what's gonna happen. So let me just put that out there. Let's hold on. Give me a second. So I'm gonna take a little drink here of my water. Oh God, that's funky. Okay. If you're an adult, oh, okay, that's close. See your doctor if you have a sore throat and any of the following associated problems. According to the American Academy of Oto, you know what, I'm going to try this word, head and neck surgery. Okay, cool. Again, if you're Canadian, I'm assuming this is all good for you. Then he lists a whole bunch of other shit. Sore throat. Severe or lasts longer than a week. Difficulty swallow. Guys, we went through this shit already. What's going on here? Could be something I don't know. Earache. Yeah, okay. A rash. I mean, it depends. I mean, it depends where it could be, but anyways, fever higher than 101 Fahrenheit, 38.3 Celsius. I haven't used a thermometer since the 80s, so I'll assume I'm just okay, I guess. Blood in your saliva or phlegm, in your whatever. I don't taste anything, so I'm good. Frequently recurring sore throats. A lump in your neck. Yeah, we went through this again. Yeah, the horse thing, the swelling. Okay, yeah, I get it. Yeah, guys, I get it. I'm fat. Okay. Yeah, I just, man, what time is it? It's only 9:18 at night. Ah, shit. Okay, well, oh, God, that hurts. Okay, Causes, viruses that cause the common cold and flu. Yeah, we know. Viral infections, obviously. All the shit that's flying in the air, the pollen, the dirt, the dust, and fuck. Okay, so they say, trying to retrace my steps here. Today is Wednesday. So that means when someone gets sick, they have the symptoms usually, 2-3 days before. So what was I doing on those days? I was working, surrounded by a lot of people. Fuck. Yep, that's it. Okay. Yeah. Bacterial infections. A number of bacterial infections can cause cause a sore throat. The most common is Streptococcus pyogenes. You know, the sad thing is, like in life, I've always wanted to do voiceovers. I really have to learn how to read. Group A, Streptococcus. We just said that. Fuck off. Which causes strep throat. Okay, buddy. Other causes of a sore throat include allergies. I just said this. Allergies, yeah, from pets and mold and dust and pollen and blah 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 blah. Dryness, dry indoor air. Okay. So now it's gotten to a point in my life where my air in my home is the enemy. Okay, great. Let's see. Eerie, tense. What? Outdoor air pollution. Tobacco smoke. Yeah, you see, that's another thing, man. When you got this, you can't smoke cigarettes, you can't smoke weed. I got some weed yesterday. I'm not going to tell you guys how, but the point is, it just, now I just got to wait on that. Okay. Muscle strain. You can strain muscles in your throat by yelling, talking loudly, or talking for long periods without rest. Okay, so that means my dad is sick all the time. Anyways, gastriophageal reflex, whatever, GERD, there you go, bud, is a digestive system disorder which stomach acids back up in the food pipe. Okay, beautiful. I think I have every single one of these. I face one of these all the time, and this is just insane. I mean, that's what I'm saying, guys. I mean, what are you gonna do? Live in, a time capsule? Are you gonna be Bubble Boy? Are you gonna be like, just living in a plastic tube and, playing board games with George Costanza? That's not how I want to live my life. And tumors, HIV infection. Holy fucking shit. Oh, this never seems to get, this is just getting worse. Rarely, an infected area of tissue, abscess in the throat, or swelling of a small cartilage lid that covers the windpipe, epiglottitis, can cause a sore throat. Both can block airway, creating a medical emergency. Okay, oh, Jesus. I mean, there's no chance that, like, there's any, movies or shows or, like any musics that relate to sore throat. No. Like, nobody's ever written a song that's meant for a sore throat. No. Yeah, I'm not going to waste my time on that either. Although anyone can get a sore throat, some factors make you more susceptible, including age, exposure to tobacco smoke, allergies, exposure to chemical irritants, chronic or frequent sinus infections. Oh, I'm getting tired. Close quarters, weakened immunity. weed whacker. Anyways, wash your hands. Prevention, by the way. Fuck it. Avoid sharing. Oh, avoid sharing food, drinks, glasses. Oh, okay, all right, okay. Because I'm saying, it's care to share. That's all. Cough or sneeze. All right. Yeah. Avoid coughing and sneezing. Okay. Throw the tissue away. Yeah. Okay. Yeah. Cool. Just like masturbation, throw it away. Use alcohol-based hand sanitizers. All right. Cool. You know what? I don't like hand sanitizers. I don't. They got this weird kind of chemical smell, and they leave whatever the fuck. They leave your hands like stickier and shit. I don't like it. I don't like it. I'm sticking with liquid soap. Avoid touching public phones or drinking fountains with your mouth. It's 2019. I still can't believe we have those. I saw a fountain recently. I can't imagine anybody using it. And I'll tell you something right now. Like you ever go to a fountain and like I'm not saying I'm the tallest person in the world, but I don't know. Like they're meant for like people that are like 4 feet. Like I don't know. Maybe people are getting bigger since they built them. I don't know, but I mean, listen. I'm not a drug dealer. I'm not gonna use a public phone. Okay, cool. Regularly clean telephones, TV remotes. Oh God. And computer keyboards with sanitizing cleanser. When you travel, clean phones and remotes in your hotel room. Well, no problem there. I haven't been to a hotel room in years. Funny story. I did go to a hotel room one time. I accidentally locked the door from the inside. This girl I was seeing, she tried to use the card to get in. She had to get the maid there to open the door. This is how out of it I am, guys. I didn't even know. Like even with a card, you couldn't even. All I'm trying to say is it's not a problem. She still got me Wendy's. It was a little cold, but I still enjoyed it. It was a thought that counts. I liked it. I got shit after all that though, but still, I forgot the Leafs won. But anyways, avoid close contact with people who are sick. Something. Some things are just unavoidable. It's true. Like you never really do know when a person is sick. Or even like physically, mentally. I mean, I'm assuming they mean physically, but yeah. Holy fuck, I'm exhausted. Vocal fry. Anyways, so I guess the last thing I'll end with is I don't know, strep throat. I mean, a lot of people just assume it's about what's it called? Eating pussy. So look, I'm not gonna lie to you guys. I'm not like DJ Khaled. I actually do enjoy going down on women. I'm not saying I'm like Michael Douglas or anything, but I'm just that's my thing. Well, it's not really my thing, but it's like I listen. If a girl gives you head, you'd like to return the favor. And a lot of girls don't feel comfortable about 69. And if you're a guy, you don't want to be on top because it's it's not masculine, and a woman, some of them don't feel comfortable on top. I don't know. But still, that's I don't mind it. You know what I mean? I think it's cool. It's nice when you give your lover, hey lover, that pleasure she deserves. So, and I've been seeing this girl. But, I have, in the last month, pleased a woman. And, she said that she's never had that done to her before. Which, by the way, I can hear all you guys laughing right now. I don't believe that shit either. But at the same time, it's like, you get a sense of what is okay and what's not. So, I'm not saying this is from this. If anything, I know it's not from this because it hasn't been for a bit since I've done it. Hence the 2-3 day rule. So all I'm saying is be clean out there. And, you know, if you have a sore throat, just take care of it, you know. And if you go down on your lava, just make sure that everything is okay down there and not under construction or, you know, too slippery when wet or just anything. Just be careful. You know, overall, we're meant to have fun. We got one throat. Let's use it. But at the same time, we got to take care of it. You know? So just go nuts. But be careful. Go down. Relax. Have a cough drop. And just make sure that you don't end up with a sore throat.